Hi everyone! So I thought it was time for another informative video about guinea pig health. And this video is all about malocclusion, which is a common problem that guinea pigs can get with their teeth. And it basically means misaligned teeth, which is usually the result of overgrowing teeth. So malocclusion is really important to know about, and this is because it's one of the 4 killer diseases that make up a huge 90% of cases where a guinea pig becomes ill. And the other 3 are mange, vitamin C deficiency and pregnancy toxemia. So good teeth is essential for a guinea pig because they are basically eating machines, as I'm sure we all know. They need to eat pretty much constantly just because that's the way their bodies work. So obviously it can be very worrying if they stop eating, and if they've got problems with their teeth they might not be able to eat properly, they might cause sores inside the mouth, it might be very painful for them, which again puts them off their food. So there are different things that can go wrong with the guinea pig's teeth, but in this video I'm just going to focus on the most common, which is overgrowing teeth. So first I'm going to give a brief intro to guinea pig teeth in general, and then explain about what causes overgrowing, the symptoms, diagnosis when you take them to the vets, what the vet will do, treatment and prevention. I just want to say here that I am not a vet, I'm not medically trained in any way. This video, along with all my other healthcare videos, comes from hours and hours of research on websites, forums and books, as well as my own personal experiences as a guinea pig owner. So in fact guinea pigs have 20 teeth, which is quite surprising when all we ever see is the incisors at the front. They have 4 incisors and then a big gap where other animals would have their canines. Then at the back they have 4 pairs of molars, which do all the real chewing and grinding up of the food. Now if you try and look inside your piggy's mouth, if they will let you, we've got Annie here and she's might let us have a quick look. So if you push the lips apart, what you'll see is that it's really hard, impossible to get a view of the molars, and that's because they have these kind of big fat cheek pads filling up that gap between the front and the back teeth. If you feel along the jawline, you can feel where these back teeth start. So I can feel them here just below her eye, and they go back kind of along to almost the back of her ear, and then you can feel the gap where the cheek pad is and the incisors at the front from the side. So it's really good to make feeling along the jaw part of your piggy's weekly health check, and if they kind of flinch or squeak, then it could mean that they are developing an abscess or there's something else which is causing them pain or sensitivity, and you can take them to the vet because it's always best to get these things checked out earlier rather than later. So as these teeth are constantly growing, they can become overgrown if the rate at which they're getting worn down by eating is slower than the rate at which they are growing. And overgrowth often happens at a similar or same time for the front and the back teeth. For example, as the back teeth overgrow, there's a kind of reduced ability to chew, and then the front teeth may not be worn down properly as a result. And what happens with the bottom teeth is that the lower ones kind of angle in towards the centre of the mouth. So when they overgrow, they can grow over the tongue and sometimes trap it. And the top ones do the opposite. They kind of grow outwards towards the cheeks and they can cause sores inside the mouth. So what causes overgrowth of the teeth? Sometimes it can be genetic, especially if this happens when the guinea pig is under 2 years old. It can also be a result of other illnesses or a change in their eating patterns. So for example, if the guinea pig is in pain or feeling depressed, not eating as much might mean that the teeth are growing faster than they can be worn down. And sometimes a broken front tooth or other kinds of trauma can offset how fast the teeth are worn down, although usually piggies cope very well with a broken or removed front tooth. Another possible cause, which I think could be one of the main reasons why some guinea pigs develop overgrown teeth, is their diet. So looking back, guinea pigs in the wild would have survived on a diet very high in roughage and fibre, with loads of fresh and dried grass and herbs. They wouldn't have had anything like pellets, of course. So today we give our guinea pigs pellets, which don't wear down the teeth as much as hay or grass, and that's because grasses have these compounds in them called silicates, which is kind of a natural defence for the plant, but these are the same compounds that are in sand and glass, and so they wear down the teeth very well whilst the guinea pig is eating. Not providing enough of this coarse roughage in the diet could mean that the teeth aren't worn down quick enough. So it really is important to give your guinea pigs a fresh supply of hay 24/7. So if we have no fresh grass to offer them, we can encourage them to eat more hay by giving them different sorts and making it easier for them to eat it. Always putting hay in a hay rack or a hay bag means that the guinea pigs have to work more for the hay, which is good in some ways, but they will probably consume more of it if it's more freely available to them. And that's why I always give my guinea pigs litter trays full of hay. They spend a lot of time in there, they're often kind of chilling out, and it really encourages them to keep eating that all-important hay. So signs that your guinea pigs might have overgrown teeth include things like not being able to eat properly, picking at their food, or attempting to chew something and then dropping it. Some websites say watch them when they're eating carrots for little bits falling out, and whilst this will happen if the piggy has overgrown teeth, I also think that it happens anyway to a certain extent, so I'd look out for other symptoms too before you get too worried about that. Some piggies are just messy eaters. So there's a great list of other things that you can look out for on guinea links. Things like, are they over chewing and overstretching their mouth when they're eating? Is there discharge from the eyes or nose, which could mean they've got an abscess? Are the front teeth even looking? Are they eating slower than usual or slower than other piggies in the cage? And do they prefer soft food over hard? Later on, the mouth of the guinea pig might kind of hang open because they can't shut it properly, and they also might have a wet chin from dribbling. One thing I highly recommend doing is weighing your guinea pig weekly. A gradual drop in weight is likely to be the first sign of teeth problems, and noticing this and getting your piggy to a vet before they become seriously ill is massively important. It could mean the difference between life and death without sounding too dramatic. Weighing is not, of course, just for teeth problems. A loss in weight is often the first sign of any kind of illness, so by weighing and taking your guinea pig to be checked out, you really could be saving their life. If you have noticed a drop in weight and you think that there may be something not quite right, then the next step is to take your guinea pig to a good, experienced vet, ideally a odontologist. And when you take them to the vet will feel outside of the mouth first, so they'll go along the jawline, feeling around for any spurs or any sensitive areas, and then also look inside your guinea pig's mouth using a lighted scope to push past these cheek pads. Even then it can be difficult to get a good view of the molars. A lot of guinea pigs have a habit of just having loads of food knocking around the mouth, which can obscure the molars again. What they might also use is buccal pad separators, which sound quite scary, but they're just a tool that you put inside the guinea pig's mouth, and it pushes these fatty cheek pads out the way so you can get a better look at the molars. And they also might take x-rays, and x-rays are really good for other kind of teeth problems such as elongated roots. So treatment for overgrown teeth usually involves clipping or filing the teeth down, and this can be done without putting the guinea pig under anaesthetic, and I think it's becoming more and more common for vets to avoid using anaesthetic for dental work, which is obviously preferable because putting them under is so risky for such a small animal. It's a long time for them to go without any food, and there's a risk that the digestive system might start shutting down. So all cases are different, but often the guinea pig needs to go back to the vets and have the teeth filed down every few months, or sometimes as often as every few weeks. So obviously this can get very expensive, so it's a good idea to plan ahead and put some money away for future vet bills. Another form of treatment that you can read about on guinea links is the chin sling, and this is like a support for the jaw, and it also encourages re-strengthening of the muscles, which again encourages the teeth to wear down naturally. So if you're interested in having a read of that, then it's in the link in the description box. So as for prevention, there's not really anything specific we can do to prevent it happening. Often the causes are things like other illnesses and general weakening of the muscles and the teeth not wearing down naturally. But there are some things we can do to prevent suffering and get treatment sorted earlier. So first things first, you can observe any changes in how your guinea pig eats its food. You can examine the incisors regularly for breaks and irregular wear. Things like slanted teeth, if they're going off to an angle, that could indicate something is going wrong with the back teeth. So that's something you can do during your weekly health check. And also, of course, as I've said loads, weigh your guinea pig weekly. Weight loss, again, is an early indicator of loads of problems, including malocclusion. And also think about hay. So hay should make up 80% of their diet. Ask yourself, are you providing enough? And are you doing enough to encourage them to eat lots of hay? Chew toys are great for wearing down the incisors, but really they shouldn't really be thought of something that you put in the cage to make sure that they wear their teeth down. Because they only wear down the incisors, they don't have any effect on the molars at all, and some guinea pigs often don't use chew toys anyway. So I hope this video was helpful. Thank you for watching. If you got to the end, then please let me know. I know it was a bit of an information overload. Please leave a comment, tell me what you thought of the video. If you have any stories of your own to share, or any other advice that people might find helpful, then please share that too. As always, lots of information in the description box and lots of links for you to have a look at if you're interested in reading more about it. So thank you for watching. That's goodbye from me and goodbye from the piggies.